Thank you, Chase. And with the season premiere of the show Stranger Things final season last week, we're going to be covering some Stranger Things or weird medical phenomena today. Here to shed some light on these conditions is Nurse Christina Paris. Thank you for coming on in this morning.
Yeah, glad to be here.
Now, the first thing that I think of when I think of weird medical phenomena is the show House. I'm sure that's probably, in people's mind from back in the day.
Yeah.
Sadly, no longer coming out new, but tons of seasons to rewatch.
I always had that rare medical event
it's never just some infected cut or something, and they're like, oh, just put a Neosporin on it, you're good to go. It's just like, oh, you have this rare disease that is going to be, deadly within like the next 48 hours. It's like, oh, great.
Well, the good news is we're not talking about any rare deadly diseases.
Terrific.
But more on the lines of unusual phenomenon. So more with the brain, things that we might see or don't see or experience having to do with the brain. So the first one that I want to talk about is the Baden-Meinhof phenomenon. So it's called frequency illusion. Basically, it's two-part, it's cognitive biasness and then selective attention. So all that to be said, you're more aware of something, you tend to see it more often. For example, when I had my last car was silver gray. And I felt like everybody had silver and gray cars. So I went in and I told the car dealer when I was buying my new car that I wanted a different color because gray is everywhere. So I got a white car. Well, guess what? There's white cars everywhere.
Yeah.
So not so much that there are new white cars, it's that now I'm more conscious about seeing white cars. So even things like words you might learn, you'll find, oh my gosh, I hear that word everywhere. Or you just learned about a new medication. You're gonna see commercials for it everywhere. So it's not that it wasn't always there, it's that you are more conscious to it. So it's a frequency illusion or Bader-Meinhof phenomenon. So that one is really, I bet a lot of you out there are thinking, oh yeah, I know that. I understand what she's saying.
Yeah, there's a phrase that I was thinking for a second on what the word was that I was thinking of, and it was, nonchalant.
Yes.
It's, relaxed and stuff like that. Well, on TikTok, there's this big thing going around with these videos, and they're always like, oh, I want, a chalant partner, because I don't want nonchalant. So I've been hearing them use chalant all the time now, and sure enough, I went over to the to get my hair cut, and I heard the receptionist behind the desk saying chalant unironically in conversation. And I told them, I was like, you're the first people I've heard say this word. And it probably has been said a little bit
And now we're all gonna hear it everywhere. You can say you heard it first from Michael.
It's awful, it's an earworm. But,
it can be.
But please, what's the next one we're looking at here?
White coat syndrome. Many of you might have already heard of this. It's what causes your blood pressure to spike when you go into the clinic, or if you're having a procedure done and you're in a medical facility. And just the anxiety of being in that medical place can cause your blood pressure to go up. Believe it or not, I work in clinics, I've worked in hospitals, I've worked in the medical field. I still get really nervous when I go into the doctor. It is. It's unusual to be on the other side. It's very intimidating, but know that we are here for you, and we will do anything we can to make you more comfortable. But yes, it is a phenomenon. It affects approximately 15 to 30 patients, and their blood pressures can go up 20 to 30 millimeters per HD.
No, I've had that happen. It's not every time. I was just, when I was getting into a new doctor for, I was like all nervous because, it was the first physical I had in like a year or two. And it was, getting back into the groove of things. And I was very, I was nervous. I had the the higher blood pressure. They're like, calm down. They're like, you're fine. And so, they took it at the end of the thing. They're like, yeah, you're normal. And I was just like, well, that's a relief. I was like, one thing going for me.
And that's what they'll do. Often once, you've relaxed, you've gotten through the appointment, and then they'll retake it. The next one is phantom limb syndrome. So this affects about 80 to 90% of amputees. So people who have had to have a leg amputated, an arm amputated, and sometimes even people who have had mastectomies, so had their breast removed, or had their teeth removed, they can feel phantom pain there as well.
Wow.
So the brain or the nerve that would go to that body part still thinks it's there. And so it can interpret the pain that, might be in the foot. Sometimes people will say they feel like their leg is in a different position, but you can't do anything about it because the leg isn't there. So one of the things I found interesting that they're doing for treatment for that is that they'll use a mirror, have you look at the mirror, they'll move the side that has the foot into a normal position, and somehow psychologically you think it's the foot that's missing. So try that at home if you're ever having that. But yeah, I thought that was an interesting way to combat that or treat it. There's also surgeries that they'll try to kind of dull the nerve, or there's different things they can do. So if you're experiencing that, I know it's very uncomfortable, very frustrating. Please do talk to your doctor. There's things they can do. This next one, Capgras syndrome, imposter syndrome. This is another one that I've heard of. So it happens typically with people with dementia or schizophrenia, or they've had a brain injury. So it's a disconnect between facial recognition and emotional response. My grandmother's sister, I can remember my grandmother telling me her sister would call her to say that there's some stranger in her house. And she was terrified. And it was her husband of 50, 60 years. But for some reason, she may have recognized him, like, you look like Michael, but you're not. There's somebody else different there. And they are convinced, in their head, that you have taken over the body of, the person they know. The big thing with this is you don't want to get angry. You don't want to say, no, that's your husband. You've been married 50 years. That's not a stranger. Because to them, it's real. So you want to be empathetic. Like, that must really be scary for you. Would you like me to come over? Or another thing someone said is to announce when you're going into a room. So, Michael, if it were me, I would say, Michael, I'm coming into the room. And so that, because the voice is separate from the visual. So sometimes by announcing that, then they know, okay, it's Michael coming into the room. So that was something they said. Also just trying to change the subject. So start talking about, oh, hey, I know you really like skiing, or were you gonna go skiing this weekend? So just changing the subject to something that they enjoy can sometimes get them off of that scary feeling, because that would be terrifying. And it's out there. A lot of people with, like I said, with dementia, Alzheimer's, things like that. Okay, the other one that was fascinating, foreign accent syndrome. So you don't really develop a foreign accent, but what happens is that it's a rare disorder. It only has about 100, 150 documented cases, although 60 Minutes, quite a few years ago, did a whole segment on this. So I was able to kind of hear from people who had it. So all of a sudden, and these people, they thought maybe it had to do with some kind of brain trauma or injury, but some people just had bad migraines. One person had surgery and it was just post-surgical. Another, it was due to a medication, but it altered the way they spoke. So it doesn't actually, you don't actually pick up a foreign language, but it changes the cadence, the pitch, and the intonation in the way you speak. And so you might have always said water, and now you say the water is, it just changes. And even the person knows, I'm not saying water, I'm now saying water. But they can't change it. So you can, you could try speech therapy, you can try different things, but crazy, weird mental phenomenon. Another one's blind sight. This one's really interesting too. Okay. So, and I know I gotta speed up here, I apologize everyone. So this one are people who are actually blind, but can, so they can't see anything, but they can they know something's there. They said it's like a feeling, like they're blind, but they can navigate a room. Like they know the chair is here, they know the desk is here. So somewhere in the brain, the part of the brain that makes them see is gone, but the part of the brain that would interpret where things are in position to you are still there.
That's wild.
Like they could identify X's and O's when put in front of them, or vertical or horizontal lines when put in front of them, but
That's
they're really
crazy.
technically blind. Yeah, isn't that crazy?
That's a really neat thing.
Yeah, and the last one really quick is nocebo effect. So it's like placebo. Placebo effect is positive. You know, you think something's gonna help you, and so in your brain, you convince yourself that it's helping when it really might not be. Nocebo is the opposite. So you think something bad is gonna happen, and it does. Or you're given a medication and you say, you know, your doctor says, well, this could cause nausea, and you go home and you're nauseous. May not be that you're actually nauseous, it's just that your brain is, you know, you've got it in your head. People with pain will often feel this. So people who have pain, sometimes when they find themselves distracted doing other things, they don't. If you stop to think, you're not feeling the pain. It's because you're not telling yourself you have pain. You're not telling yourself, you're not constantly fixating on the pain because you're otherwise preoccupied. So I'm sorry. That was really a long segment, but I thought these things were really cool.
Yeah, no, thank you for sharing. These are certainly a lot to think about as we head into the holiday season here. And, you know, thanks for dragging these up. I appreciate it.
And absolutely. And of course, as always, if you have any questions about these things, or you think that you might have some of these syndromes, please go and speak with your doctor.
Thank you so much this morning. We're going to be right back with your daily dose of what's trending.